Hello, thank you for tuning into another episode of Take 10 on Tuesday with the Tennessee Tribune. I'm Jason Lentz. Today I decided to invite a special guest. This is a close friend of mine and she's doing some really good things that I wanted our viewers to know about. I'm with Sameerah Ali of Sameerah Ali Mobile Med. Hi.
Hey Jay.
Thanks for coming today.
Thank you, it's my pleasure.
All right, so first, I love the name of your business. But I would love you to tell our viewers exactly what do you do.
Sameerah Ali Mobile Med is a primary care practice. We provide wellness care, just traditional medicine, but with a twist.
Okay. So when you say a twist, what is that twist?
The twist is that it's not you come in, you have a symptom, I give you a pill, you go out. We're going to find out what's really going on. We're looking at not symptom management, but the underlying cause of disease management. So it's really preventive medicine.
Okay, so I hear that word a lot. There's a lot of discussions about healthcare in recent years. Preventive basically means we're going to decide what's causing the issues?
Right, prevention meaning every demographic, every category, men, women, age, whatever age range they fall into, they have certain risks associated with that demographic. So we assess those risks based on age and ethnicity, and we screen you based on those risk factors and see what you're more likely to have. And then we target those increased risks by saying, oh, we need to do this or we need to not do that, so that you don't develop the diseases that you're most likely to develop.
Wow, so is this different from, there are other doctors' offices or medical offices, they don't attack problems the same way?
They do. I'm not saying that they don't. I think the difference is we focus more on nutrition.
Okay.
Food first, dealing with what you eat. What you eat can determine your wellness or your sickness. So if we start with your foundation of food and to build upon that, we have better outcomes. So
most of our viewers are African American, and I also hear a lot about our dietary habits are not the best. What is something that we can do to change that, or is there an idea you have that can make us eat better?
Yes. I'm African American, so I know the struggles. I am a part of a program called First Line Therapy, and it stems from some of the guidelines that have been created by the major medical community for controlling lipids, cholesterol, and they say that first line therapy should be therapeutic lifestyle change, which goes back to diet.
Okay.
So you have to integrate these little dietary changes, something realistic. You can still eat a so-called Southern diet, but there's a way to modify it by pulling some of the fat out, preparing it a different way, not eating so much of it, and also adding in, phytonutrients to help protect the cells which are damaged from a poor diet.
Now, another thing I was wondering, since we're on diet, I've noticed when I go to certain restaurants, it seems like you get a lot of food. I'm always taking food home. Is that something that I've just noticed, or have restaurants increased in the amount of food they give us?
They have, absolutely. The portion sizes have increased.
Portion size. What kind of effect is that having on us as a community?
We eat more. We eat more at each meal, and we eat more meals, because now they're selling this 6 small meals. But the small meals are relative, in size, because what you call small might not be small to me.
Yeah.
So that's part of the behavior change. We have to say what's a portion size really.
Wow.
Not just what you go out and get on a plate of food when you eat at a restaurant.
So yeah, I always hear 6 small meals when they're talking about losing weight, but sometimes you eat 6 times, but you end up still ordering the same amount
Exactly.
of food. Wow, that's that. Okay. So you want to focus on that.
Yeah, we have to focus on it. And sometimes you can eat 6 small meals a day, but it's what you're choosing to eat. See, we've moved away from a plant-based diet. Most of what we eat is all the same colors, the browns, the whites. There's no color, there's no variety. The plants have gone. We eat out of bags and boxes. So that's the behavior change we have to focus on.
So vegetables are important.
Vegetables and fruit, a variety of color.
A variety of color. Yeah, we don't want that bland plate.
Just like us.
Yeah,
varieties of color.
Varieties of color. I like that. Now, so how long have you been in business?
I opened my doors April 2014.
Okay. Now, how do you feel being a small business owner in Nashville? Do you feel Nashville's good for your business? Do you see the growth that we hear so much about?
Yes, I moved back to Nashville in 2012, just with the intention of starting my business. So I felt like Nashville was a good feeding ground, seeding ground to develop and grow, because the community is growing. It's diverse. People are coming here, lots of businesses. It takes a while, so you have to be really committed to the work and the development and the grassroots and the getting out and talking to people and letting them know what you do. So absolutely.
Oh, that's great. One other thing I want to touch base was, so you're a nurse practitioner.
I'm a nurse practitioner, yes.
Okay. So let's the audience know what exactly is a nurse practitioner compared to other nurses, or even compared to a doctor.
A nurse practitioner is a registered nurse. We have advanced training. We usually have master's degrees or doctoral degrees.
Okay.
And our training is in traditional medicine or medical model. So we learn the same things as a physician would learn. In Nashville, it's a little different. Vanderbilt has a program where you don't have to be a nurse first, and you can go and become a nurse practitioner, but most programs around the country is required that you have time as a nurse.
Okay.
Working as a nurse so you can learn the medical model. And then we do advanced training, didactic, and learn how to practice medicine.
Wow.
So we go from taking orders to making them.
Making orders. So a nurse practitioner can write prescriptions?
Yes. I have a DEA license.
Oh,
Right,
great.
prescriptions for antibiotics and certain drugs. It's functional medicine. I can't prescribe drugs, but I like food first. If you have an acute illness, you need an antibiotic, absolutely, we're going to treat you for that.
Okay. But your goal, like you said, is a preventive. You're going to look at what's causing the problems and see if there's natural ways to handle that first, rather than just shove a pill.
Yes.
Oh, that's great. That's great. So now, I'm sure a lot of people would definitely be interested in learning more about your business and how to contact you. Do you have a website, email, anything that you'd like the audience to have?
I do. My website is samobilemed.com. And you can email me at info@samobilemed.com.
Oh, that's great. All right. Well, I really appreciate you coming out today, and I'm glad we talked about the diet because I know it's so important now. And definitely appreciate you coming.
Thank you, Jason.
Thank you so
Thank
much.
you.
And once again, you've been tuning into Take 10 on Tuesday with the Tennessee Tribune. See you next time.
Peace.